Neurosurgeons frequently encounters patients with degenerative cervical myelopathy, DCM, whose disabilities might have been avoided if only they had recognized the early signs of their condition. Degenerative cervical myelopathy is the leading cause of spinal cord impairment in adults, which can rob people of their mobility and independence if left untreated. An estimated 1 in 10 people will eventually develop the condition, which is commonly diagnosed among patients over the age of 50. And as the proportion of older patients rises, neurosurgeons believes it's now more important than ever that people recognize the signs. People need to be aware of this. It's an important cause of neurological impairment, and there are effective treatments available now. There is a modern clinical practice guidelines offering new recommendations on how to manage mild, moderate, and severe degenerative cervical myelopathy. But still, neurosurgeons often sees patients with degenerative cervical myelopathy whose symptoms of tingling hands or neck pain were previously misidentified as carpal tunnel syndrome or dismissed as part of normal aging. Here's what you need to know about degenerative cervical myelopathy.
Degenerative cervical myelopathy involves compression and injury to the spinal cord, which, over time, can cause serious disability. This occurs when the discs between vertebrae wear out, leading to bulging of the discs, or when the ligaments around the spine ossify, that is, harden into bone. There is not much people can do to prevent this from happening. One of the main causes of cervical myelopathy, a condition called ossification of the posterior longitudinal ligament, or OPPL, is not preventable. The cause of ossification of the posterior longitudinal ligament is unclear, although there are genetic factors, and the condition is more prevalent among patients of Asian descent. However, smoking is a known risk factor for cervical spondylosis, a degenerative disc disease that is another main cause of degenerative cervical myelopathy. Besides abstaining from smoking, neurosurgeons recommend avoiding repetitive trauma, such as extreme weightlifting that puts heavy loads on the neck.
About 50% of patients who are diagnosed with degenerative cervical myelopathy initially report having neck pain, a symptom that should prompt a look at whether there's any compression of the spinal cord. In some regards, neck pain is a little bit like high blood pressure. In other words, it can be a red flag of something very serious. Early on, patients may also experience some impairment in their walking, although they tend to downplay this symptom, shrugging it off as clumsiness. Doctors can recognize this by asking patients to walk in a straight line, heel to toe. If you're stumbling all over the place, then that's a problem. Another common symptom of cervical myelopathy is numbness and tingling in the hands. Patients may begin to have subtle difficulties with tasks requiring fine motor control, such as doing up buttons, handwriting, or sewing. These symptoms are commonly misdiagnosed as carpal tunnel syndrome. A further sign there may be something wrong with the spinal cord is what's known as radicular arm pain, or pain that radiates down the arm. So even if people don't have neck pain, they could have degenerative cervical myelopathy if they experience some of these other symptoms. The standard diagnostic tool to confirm whether someone has degenerative cervical myelopathy is magnetic resonance imaging of the cervical spine.
Patients with mild symptoms should be monitored and may benefit from physiotherapy, and adding surgery may be offered as an option. But in some cases, if their condition deteriorates, surgery is required.
Other patients may remain stable, but they should nevertheless avoid high-risk activities, since degenerative cervical myelopathy is a common underlying cause of spinal cord injury. For example, neurosurgeons often operate on patients who likely had undiagnosed degenerative cervical myelopathy. Because the patient was unstable walking, they fell, injuring their spinal cord. The takeaway? If you know you have degenerative cervical myelopathy, it's probably best if you avoid mountain biking or horseback riding. Neurosurgeons recommend surgery for those with moderate to severe impairment. Surgery is performed to take pressure off the spinal cord and, in some cases, to reconstruct areas of weaknesses. For instance, this can involve removing the discs and placing a bone graft into the disc space to open it up, then correcting the alignment of the spinal cord and reconstructing the area of the spine with a titanium implant. Most patients only need surgery once, but as they age, some may need further surgery on untreated areas of the spine.